Part A. Extract 1. Questions 1 to 12. You hear a neurologist talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Good morning, Mihira. Could you start by telling me what brings you in today?
Yes, thank you, doctor. I don't know where to start, actually. It's been a really tough few months. I've been feeling, well, disconnected from myself, almost like I'm looking at my life through a fog. At first, I thought it was just stress, but it's getting worse. I can't concentrate, my energy is non-existent, and I often find myself drifting, staring off, sometimes for an hour or so, without even realizing it. I also feel hopeless and, well, more irritable than usual.
I see. It sounds like you're experiencing more than just stress. And how would you describe your mood overall? Are you feeling down or
Depressed, yes. It's definitely more than sadness. It's like a persistent emptiness, and I wake up each day dreading the hours ahead. It's impacting everything, my work, my family, my whole routine. I feel like I'm on edge all the time, and I'm even finding it difficult to sleep, which just adds to the exhaustion. And the worst part, I think, is this constant fear that I'm losing my mind. My thoughts get so jumbled, and I forget things, sometimes even basic tasks or conversations I've just had.
It's good you've come in to talk about this. Let's go over some of these symptoms in more detail. You mentioned trouble with memory and concentration. Could you clarify that a bit more?
Certainly. Well, I'm a project manager, so I'm used to managing complex tasks, but recently I can't even focus long enough to send an email without reading it over 5 times. I'll go into the kitchen and forget why I'm there, or I'll be in the middle of a conversation with my husband and suddenly lose track of what I'm saying. It's like my mind just goes blank. I also feel this constant sense of dread, like something terrible is going to happen, even if there's no reason for it.
That sounds distressing, Mihira. And are you on any current medications or treatments for other conditions?
Yes, actually. I was diagnosed with generalized anxiety disorder about 3 years ago. I was prescribed an SSRI, sertraline, but about 6 months ago, I felt like it wasn't helping as much, so my GP switched me to venlafaxine. I'm on a pretty low dose, I think, 75 milligrams a day. I also take magnesium supplements, which my friend recommended for my fatigue, but honestly, I don't feel any difference.
Okay. And have you tried any other remedies or therapies to manage these symptoms, aside from the medication and supplements?
Yes, I've tried a few things. I've been doing some yoga, which was supposed to help with relaxation, but most of the time, I end up feeling more agitated. I also tried cognitive behavioral therapy, but I only managed 3 sessions. It was difficult to concentrate during them, and honestly, I left each session feeling more frustrated than helped.
It sounds like you've tried a range of approaches. Before we discuss a treatment plan, I'd like to conduct some neurological and cognitive assessments to get a clearer picture. I'd like to start with a mini mental state examination to assess cognitive function, along with some memory and attention tests. Additionally, an MRI scan may be necessary to rule out any structural abnormalities in the brain. There's also a possibility we'll need a blood test to check for vitamin deficiencies, thyroid function, and metabolic factors, which can sometimes mimic or exacerbate depressive symptoms.
I see. And if it turns out that everything is normal, what would be the next steps?
If we don't find any structural or metabolic causes, I'd consider adjusting your medication. We may need to titrate your dose or try an alternative medication, depending on the results. I'll also refer you to a psychiatrist, as they may have additional insights into managing treatment-resistant depression. Additionally, we could explore other therapy options.
Okay, that sounds manageable.
Extract 2. Questions 13 to 24. You hear an endocrinologist talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Good morning, Mihira. I'm Dr. Albert Lin, an endocrinologist. I understand you're here to discuss some health concerns today. Could you tell me a bit about what's been going on?
Good morning, doctor. Yes, I'm here because my symptoms seem to be worsening, and I'm not sure what's causing them. Well, for starters, I've been gaining a lot of weight, especially around my midsection, even though I haven't changed my diet. I feel tired all the time, and my muscles are really weak. Lifting things at work has become exhausting. My face also feels puffier, almost like it's swollen.
That sounds frustrating. Weight gain and fatigue can certainly affect your day-to-day life. Can you tell me more about your job and how these symptoms impact it?
Being a forklift operator, so physical strength and stamina are really important. But lately, even operating the forklift all day makes me feel drained. My back and shoulders hurt, and sometimes I get dizzy. I've even noticed some new bruising on my arms and legs, which is odd because I don't remember bumping into anything.
That does sound unusual. Have you had any other symptoms you can think of?
Yes, actually. I've also noticed that I feel more anxious than usual, and my skin feels thinner, like it's more sensitive. I used to have pretty strong skin, but now, even a scratch leaves a mark.
Thank you for sharing all of this, Mihira. Based on what you've described, I'd like to perform a few tests and measurements, particularly since your symptoms align with something we call Cushing's syndrome.
I've never heard of that. Is it serious?
It's a condition caused by high levels of cortisol in the body, which regulates various body functions, including metabolism and stress response. We'll start by checking its levels with a simple blood and urine test. I'll also measure your blood pressure and take a close look at the areas where you mentioned bruising or puffiness. Once we confirm the diagnosis, we can move forward with a treatment plan.
I'm a little nervous about the treatment. Is it complicated?
The treatment can vary. We may use medication Mihira to control it. Like all medications, there are potential side effects. The drug can sometimes cause nausea and dizziness or affect your liver function, so we'll monitor you closely. Surgery is sometimes needed if there's a tumor causing the excess hormone production. As for the timeline, it can take a few months to see improvement, depending on how your body responds to the treatment. And in terms of lifestyle, gentle exercises like yoga or walking may help with your energy levels. But for now, I'd recommend avoiding heavy lifting to avoid strain.
Thank you, Dr. Lin.
You're welcome, Mihira.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Now look at question 25. You hear a head nurse called Mihira talking to the team. Now read the question.
Team, I want to discuss a recent incident involving Mr. Rio. Unfortunately, he had a fall from his bed last night. This is a serious matter that requires immediate attention.
What caused the fall, Mihira?
We're still investigating the exact cause, but it's possible that he might have tried to get out of bed unassisted.
Should we consider using bed rails to prevent future incidents?
Bed rails can be effective in preventing falls, but they also have potential risks. We need to weigh the benefits and drawbacks carefully. Perhaps we can implement a bed alarm system to alert staff if Mr. Rio tries to get out of bed.
What about patient education? Can we educate Mr. Rio and his family about fall prevention strategies?
That's a great suggestion. We can provide them with information on how to use call bells, the importance of staying in bed, and the risks of falls.
Mihira, we should also review our staffing levels and ensure that we have adequate staff to monitor patients closely.
Absolutely. By addressing these issues, we can reduce the risk of future falls and improve patient safety.
Now look at question 26. You hear a nurse called Mihira talking to a patient. Now read the question.
Mr. Rio, I know being in the hospital can be lonely and isolating. It's important to maintain your social connections and find ways to stay connected with loved ones.
Mihira, I miss my family and friends. I feel so alone here.
I understand how you feel. Social isolation can have a negative impact on your mental and emotional well-being. Let's see what we can do to help.
I don't have a smartphone, so I can't video call my family.
We can help you connect with your family through video calls. We can also arrange for your family members to visit you, if possible.
That would be great, Mihira. I'd really appreciate it.
In the meantime, we can encourage you to engage in social activities within the hospital, such as board games or group activities. We can also provide you with reading materials or other forms of entertainment.
Thank you for your help.
Now look at question 27. You hear a doctor called Mihira talking to a head nurse. Now read the question.
Nurse Hilton, I'm concerned about Mr. Rio's condition. His blood pressure is elevated, and he's experiencing chest pain.
Yes, Dr. Mihira. I've noticed those changes as well. He seems to be in discomfort.
We need to adjust his medication regimen to manage his blood pressure effectively. Let's increase the dosage of his antihypertensive medication and add a beta blocker to help control his heart rate.
Should we consider any additional medications, such as a diuretic?
That's a good idea. A diuretic can help reduce fluid retention and lower blood pressure. We'll monitor his kidney function closely to avoid any adverse effects.
How often should we monitor his vital signs, Dr. Mihira?
We should monitor his blood pressure and heart rate every hour. We'll also need to assess his urine output and electrolyte levels.
I'll inform the nursing staff about the changes in Mr. Rio's medication regimen and monitoring plan.
Now look at question 28. You hear a physiotherapist called Mihira talking to a hospital manager. Now read the question. Mr. Hilton, I'm writing to express my concern about the limitations of our current rehabilitation equipment. Some of our machines are outdated and malfunctioning, which is impacting patient care.
I understand your concern, Mihira. We've been facing budget constraints, and it's been difficult to allocate funds for new equipment.
I appreciate the budgetary constraints, but outdated equipment can lead to inefficient therapy sessions and hinder patient recovery. Investing in modern equipment can significantly improve patient outcomes.
I agree, Mihira. Perhaps we can explore options like leasing or renting equipment to reduce the initial cost. We could also consider applying for grants or seeking donations from charitable organizations.
That's a good idea. We should prioritize the most critical equipment needs, such as those used for balance training and gait rehabilitation.
I'll discuss this with the finance team and explore potential solutions. We'll prioritize patient care and ensure that we have the necessary resources to provide effective rehabilitation services.
Now look at question 29. You hear a nurse called Mihira talking to the team. Now read the question.
Good morning, team. I want to discuss a recent change in hospital policy regarding patient visitation hours. Starting next week, visiting hours will be extended to accommodate more family members and friends.
That's great news, Mihira. This will definitely improve patient morale.
Absolutely. We want to create a more welcoming and supportive environment for our patients. However, it's important to maintain a quiet and calm atmosphere in the wards.
How can we ensure that the extended visiting hours don't disrupt patient care?
We'll need to implement strict guidelines for visitors. They should avoid making noise, avoid bringing in outside food, and respect the privacy of other patients. We'll also need to educate visitors about infection control measures, such as hand hygiene.
Mihira, will there be any additional staffing requirements to accommodate the increased number of visitors?
We'll assess our staffing needs and adjust our schedules accordingly. We may need to hire additional staff or reassign existing staff to manage the increased workload.
Now look at question 30. You hear a cardiologist called Mihira talking to the team. Now read the question.
Team, we have a complex cardiac surgery scheduled for Mr. Rio today. Let's review the patient's medical history and discuss the surgical plan.
Mr. Rio has a history of hypertension and diabetes. Dr. Mihira, he's also on several medications, including blood thinners.
We need to carefully manage his medications preoperatively to minimize bleeding risks. Let's consult with his primary care physician to optimize his medication regimen.
What about his allergies? Is he allergic to any medications or latex?
We'll need to double-check his allergy history and ensure that we use latex-free equipment. We should also have emergency medications on hand to manage any adverse reactions.
Should we consider any specific preoperative tests, such as an echocardiogram or stress test?
It would be prudent to review his recent cardiac tests to assess his current cardiac function. We may need to adjust our surgical plan based on the latest findings.
What about post-operative care, Dr. Mihira? What kind of monitoring will be required?
We'll need to monitor his vital signs closely and assess for any signs of complications, such as bleeding or infection. We'll also need to manage his pain effectively and provide appropriate rehabilitation.
That is the end of Part B. Now look at Part C. Part C. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36. You hear the conversation between an oncologist, Dr. Mihira, and an interviewer. Dr. Mihira, the latest reports on global height trends have drawn significant attention. Could you shed some light on the most recent findings?
Certainly. The latest data, primarily from research by the NCD Risk Factor Collaboration and other notable longitudinal studies, shows intriguing patterns. We've observed a slight overall increase in global average height, but this trend isn't consistent across all regions. For instance, certain parts of East Asia and Europe report moderate height increases, while areas in South Asia and Sub-Saharan Africa have seen stagnation or even a decrease in the average height of younger generations. Moreover, the disparity between countries with high and low average heights has widened. This divergence highlights how various factors, nutritional, genetic, and socioeconomic, play crucial roles in influencing height changes over generations.
And what does this variation in height signify about the health or developmental trajectory of these populations, Dr. Mihira?
Height, as simple as it may seem, is a remarkably insightful indicator of overall health and environmental influences during growth periods. When we see increases in average height, it often suggests that a population is benefiting from better childhood nutrition, lower rates of infectious diseases, and generally improved living standards. Conversely, stagnation or reduction in height trends points to adverse conditions, such as persistent malnutrition, high disease burden, or inadequate health care. Additionally, height can even reflect social inequities. For instance, populations with limited access to resources tend to show lower average heights. So, in essence, height is a cumulative outcome of both genetic potential and environmental factors. While it may not give a complete picture, it is a reliable health proxy across large populations.
From your findings, Dr. Mihira, are there specific groups that seem to be more affected by this variation in height?
Absolutely. The data highlights a pattern where children and adolescents in low- and middle-income countries are more impacted, particularly in regions like South Asia and parts of Africa. This age group is especially vulnerable due to their critical growth periods, where they rely on adequate nutrition, healthcare, and living conditions to reach their full genetic height potential. Additionally, there are significant disparities within countries. Urban areas often fare better than rural regions in terms of height, owing to better access to resources. Gender differences also play a role, as boys and girls can have different nutritional and healthcare needs. Societal factors may exacerbate these issues in cultures where boys are given preferential treatment in terms of resources, leading to greater height disparities for girls in some areas. Overall, height inequality is multifaceted, influenced not just by national economic factors, but by local customs and access to healthcare.
Given this, Dr. Mihira, what strategies or actions should be taken to address these issues on both a societal and global level?
Tackling height disparities requires a multi-pronged approach that addresses the underlying causes, particularly during critical growth periods. Globally, nutrition programs need to be intensified, especially in impoverished regions, to provide essential micronutrients like iodine, zinc, and vitamin A, which are crucial for growth. Education is also paramount. Helping communities understand the importance of child nutrition and healthcare access can make a significant difference. Furthermore, we need policies to ensure equitable healthcare access and measures to mitigate poverty, which is often at the root of many of these issues. Collaboration between governments, international organizations, and local communities is essential to create sustainable solutions. By addressing both direct health factors and socioeconomic inequities, we can make meaningful strides in reducing height disparity.
Dr. Mihira, could you tell us about recent research focused on treatments or interventions for height deficits due to these environmental factors?
There has been fascinating progress in this area. For instance, certain interventional studies explore the potential of targeted nutrition programs, such as supplementing diets with high-quality protein and specific micronutrients. The aim is to catch up growth in children who have suffered from early malnutrition. Moreover, research into genetic therapy is beginning to gain traction, albeit in its infancy. This type of therapy, particularly promising for those with genetic growth disorders, may eventually play a role in helping children reach their height potential, even if delayed intervention occurs. Additionally, some studies are examining how probiotics and gut health contribute to nutrient absorption, which is an overlooked area that could impact growth. However, it's crucial to remember that while biological treatments are promising, addressing environmental factors remains essential, as they are often the primary culprits behind height discrepancies.
With all these factors in play, what do you think the future holds for human height variation? Will we see a continued increase or further disparities, Dr. Mihira?
Predicting future trends is complex, especially given the interplay of genetics, socioeconomic development, and global health challenges. However, if current trends hold, we may see a polarization where some populations continue to grow taller, while others experience stagnation or even decline due to worsening economic or environmental conditions. Climate change could also influence future height trends, as it threatens to reduce agricultural productivity, exacerbating food insecurity in vulnerable regions. On a more positive note, as healthcare and nutrition programs become more sophisticated, there's hope that disparities will reduce over time. But we need a global commitment to equitable health improvements if we are to bridge this gap. Overall, the future of human height remains as much a reflection of our environmental decisions as it is a biological outcome.
Now look at Extract 2. Questions 37 to 42. You hear Henry Reyes on elderly depression research at Mihira Healthcare Institute. You now have 90 seconds to read questions 37 to 42.
Thank you all for being here today. I'm Henry Reyes, a social worker at Mihira Healthcare Institute, where we are dedicated to advancing knowledge in the mental health and well-being of elderly populations. Today, I will discuss our recent research initiatives focused on elderly depression, a pressing issue that often goes underrepresented. Depression among the elderly is not only pervasive, but also poses a unique set of challenges that require specialized research and tailored intervention strategies. At Mihira Care, we are committed to addressing these challenges through comprehensive studies that allow us to understand and ultimately mitigate depression's impact on the elderly. Our key focus at Mihira Care is to delve into the social, emotional, and psychological elements contributing to depression in the elderly. The aim is to identify the multi-layered factors, from biological vulnerabilities to lifestyle and social isolation, that intensify the risk of depression in later life. The research doesn't just analyze depression symptoms, it goes deeper, looking at interrelated conditions such as cognitive decline, physical health deterioration, and the increasing loss of social connections. We are especially interested in how aging itself contributes to psychological vulnerability. which could mean refining treatment models to consider not only psychiatric factors, but also the socioeconomic conditions influencing mental health in older adults. The findings from Mihira Care's research signify that elderly depression is not a monolithic condition, but rather a complex interaction of various factors that evolve as individuals age. Our studies reveal that depression in the elderly often manifests differently than in younger populations, frequently overshadowed by physical health complaints, which can obscure mental health needs. The research also highlights an alarming trend of underdiagnosis and misdiagnosis, primarily due to societal biases that normalize sadness or withdrawal as part of aging. By spotlighting these issues, our work underscores the need for improved diagnostic criteria and tailored interventions that address both the direct and indirect causes of depression in the elderly. This research emphasizes the critical importance of distinguishing between clinical depression and situational sadness in the elderly. For instance, while grief or loneliness might be temporary reactions, chronic depression requires targeted intervention. We also underscore the value of early diagnosis and intervention, which could prevent the worsening of depressive symptoms, enhance the quality of life, and potentially delay cognitive decline in the elderly. One of the most pressing issues identified in our research is the insufficient integration of mental health services into primary healthcare for elderly populations. At Mihira Care, we found that many elderly individuals feel stigmatized or reluctant to seek help for mental health issues, often fearing it will overshadow their physical healthcare needs. Additionally, healthcare providers may lack training in recognizing depression in elderly patients, especially when symptoms are masked by or mistaken for age-related physical ailments. Another significant problem is social isolation, which has proven to exacerbate depressive symptoms and further hinders older adults' ability to seek and receive help. Our research also tackles the challenge of comorbidities in elderly patients. Depression often coexists with conditions like cardiovascular disease, diabetes, and cognitive impairment, creating a complex healthcare dynamic where mental and physical health issues must be addressed simultaneously. At Mihira Care, we are developing models to address this interconnectedness, working on strategies that bring mental health services into existing healthcare frameworks, so elderly patients feel they are receiving holistic care. Looking to the future, Mihira Care is pioneering initiatives that will expand our understanding of elderly depression through longitudinal studies and innovative therapeutic models. We are particularly interested in understanding the genetic and neurological markers associated with depression and aging, which could provide insights into preventative care and individualized treatment approaches. Additionally, the role of technology is becoming more prominent in our research. For instance, telehealth platforms may provide new ways for elderly individuals to access mental health care while reducing the stigma attached to traditional therapy. In the coming years, Mihira Care aims to broaden its research scope to include community-centered models that leverage social networks to support elderly mental health. By embedding support systems in community settings, we aim to reduce isolation and create a sustained positive impact on mental wellness. Future studies may also focus on integrating alternative therapies, such as art or music therapy, which have shown promising results in reducing depressive symptoms in elderly populations. To translate these findings into actionable changes, Mihira Care is developing training programs for healthcare providers to improve their ability to recognize and treat depression in elderly patients. By creating a framework where mental health is an integrated part of overall healthcare, we aim to ensure that elderly individuals receive comprehensive care that doesn't neglect their mental well-being. Collaboration with local communities is also crucial, as creating safe and welcoming environments can encourage older adults to engage in mental health programs without fear of stigma. Mihira Care is also prioritizing partnerships with governmental and non-governmental organizations to expand access to mental health resources for the elderly. Through these partnerships, we hope to introduce policy changes that recognize elderly mental health as a public health priority, thereby making care more accessible and affordable. Educational initiatives aimed at families of elderly individuals will also play a role in reducing the stigma around elderly depression, helping caregivers understand the symptoms and seek help proactively. The primary focus for Mihira care moving forward will be on early identification and intervention, recognizing that these are key to preventing the severe impacts of depression among elderly individuals. This entails developing robust screening tools and protocols that healthcare providers can easily integrate into routine checkups. Emphasis will also be placed on creating community support systems that reduce isolation and promote mental health among the elderly. Additionally, Mihira Care will focus on broadening its research scope to encompass cross-cultural studies, ensuring our insights and solutions are inclusive of the diverse experiences of elderly individuals in various cultural contexts.
That is the end of your OET listening test. Now check the answers.